Today, we're gonna talk about how to prevent and take care of some of your back pains at home.
I have all the tips right here.
Hey everybody, Dr. Francisco here,
Dr. Sebastian here.
and welcome to our channel. We hope you learned a little bit more about our clinic. Also, click the subscribe button and ring the bell so you get alerts of upcoming videos.
The most common complaint that we get in our office is lower back pain. When you're in pain and you get stuck, that can mean a number of things, from ligament to muscle to disc damage.
Usually, if your pain is getting worse, and when you laugh, you cough, you sneeze, maybe even when you do a bowel movement, you get increased pain in that low back, it might indicate that you're having a disc issue. Oftentimes, people will find themselves stuck in a twisted position or even bent forward and unable to straighten up from there.
If coughing or sneezing wasn't the main issue, and now range of motion is reduced and you feel tight in the muscles, that might be more suggestive of a musculoskeletal complaint.
A good suggestion in self-evaluation is going up to the mirror, or perhaps taking your hands and start poking and prodding back there. If you feel any swelling, tenderness, or if there's any visible bruising, it's a good indication that there's something going on back there that might need to take a look at.
Stand in front of the mirror, place your hands on your hips, and see if there's one side higher than the other, or perhaps you're a little bit rotated. Those might be indications that you need a more thorough evaluation with x-rays or MRIs.
If you're working from home or office and spend a lot of time sitting, make sure you stand up and move around to prevent those injured tissues from locking up on you. Also, good use of a lumbar support can be a key component of staying comfortable. And don't slouch.
When possible, take 10-minute break for every hour. When you're back to sitting, make sure your computer is at eye level, your shoulders are relaxed, and your feet are touching the floors, knees bent at 90 degrees.
When lifting, you need to prevent bending from the back. Never bend from your back. Always bend from your hips into a squatting position to lift objects regardless of how much they weigh.
For those weekend warriors like myself that want to remodel the house, do some yard work, and maybe clean your car all in one weekend, make sure to ice your back whenever you're feeling tired. Make sure you stretch, take some breaks, and know when to stop.
Now, if your weekend is more like mine, consisting of maybe a workout and then some long sessions of Netflix, avoid those comfortable but awkward positions that are sustained for a long time. Those have a tendency to create repetitive micro trauma or sustained plastic deformity of ligaments and discs. Those mold joints in a not so healthy way and can lead to a disc injury.
The best tip we can give you is make sure to dedicate time to be healthy so that you don't have to make time to be sick.
I think that's all for today. Remember, whatever life throws, we got your back.